Well, welcome everyone again. My name is Lisa Davis. I am the Director of Community Engagement and Advocacy at the Children's Partnership. It's great to have you here. Just a few announcements. This webinar will be recorded and the recording will be shared after the webinar. Q&A, if you have any questions, please drop it in the Zoom Q&A box. There will be a Q&A portion at the end of each presentation. For closed captioning, click the live transcript button from the in-meeting Zoom toolbar and select one of the options from the menu. And then at the end, we will be sharing an evaluation. We would very much appreciate for you to complete the evaluation form at the end to help us improve our trainings in the future. And now I will pass it over to Liz Joseguera from California Primary Care Association.
Thanks, Lisa. So we wanted to just welcome everyone and also remind everyone that we are an inclusive of all people and perspective. So this is a space where everyone to feel safe. And we really don't want to hear any hate. We do not tolerate racist, transphobic, homophobic, xenophobic, misogynistic, or malicious comments, and will remove and report anyone who feels the need to disrupt the groups and the space that we are in here. Our objective is to hold this webinar, again, in a safe space and allow folks to ask their questions and really just inform our communities about the different information we're going to share. So with that, we will pass it along to Lily to present our presenters and speakers today.
Thank you, Liz, and thank you, Lisa. I'm grateful to be partnering with you and your organizations and hosting this training, and I'm thrilled to introduce our panelists of experts today. We are joined by Stan Glickman. He is the Assistant Vice President of Business Growth and Innovation at AltaMed Health Services. We also have Hope Nakamura, attorney at the Legal Aid Society of San Mateo County. And then we're joined by David Kane, attorney at Western Center on Law and Poverty. And my name is Lily Dorn. I am part of the Community Clinic Association of Los Angeles County. I realized I did not introduce myself as we started. So we've got a great presentation here for you today. As you can see on this slide, we're covering public charge, the chilling effect, and then we'll dive into the public charge rule today. We'll talk about eligibility for public services by status, and then we'll dive into an intersection of healthcare and immigration, and we'll dive into Medi-Cal renewals and what providers need to know. So I will pass it to Hope now.
Thanks, Lisa. So the chilling effect of public charge. As you may or may not know, a lot of immigrant families in California say that they have, or a family member has avoided accessing healthcare, housing, or food programs because they're afraid of accessing those benefits harming their future immigration status. And that study in 2019 found that it was up 12% from the previous year. So this chilling effect of this so-called public charge rule is real. Next slide, please. But how many people are familiar with public charge rule or could explain it to somebody who has questions? Public charge is kind of intimidating because it involves both the integration or intersection of immigration law and some public benefits. But there's a simple way to break down and manage these questions, and that is to remember your ABCs. What is the rule? Does it apply to this certain kind of immigrant? And what are the benefits that are included, and then being able to check your status. So this is what you should know about public charge today. Public charge is not a tool for immigration enforcement. The lawful enrollment and use of public benefits is not going to lead to your information being shared with ICE. It does not trigger immigration enforcement against a family. Next slide, please. Oops, I keep forgetting. Next slide. Sorry, I'm behind now. And one more. So what is public charge? Public charge is a simple test that the government uses when people apply for certain kinds of immigration applications. And it allows them to deny that application if they think that the applicant is going to depend primarily on public services in the future. In order to make the decision, they look at many factors, not just benefit use. They primarily look at the health, age, the skills and education, and the family's or sponsor's income to determine whether or not this person might be a public charge. And it really only factors in two types of benefits. Next slide. So remember your ABCs. When does public charge apply? What benefits are safe to use? And how you can check to make sure. Next slide. So this may be a little bit difficult to see, but when does public charge apply? It does not apply in most situations. If you already have a green card or a citizen, public charge does not affect you. The only time it might affect a green card holder or person with lawful permanent residence is if they decide to leave the United States for more than 6 months at a time and then try to re-enter. In those situations, it might not just be a public charge issue, so they should talk to an immigration attorney if they're planning to leave. If you have some of these other kinds of immigration statuses, like you're a refugee or an asylee, or many other kinds of statuses that are listed there, there's no public charge test that applies in those kinds of situations. Really, the only time that it affects somebody that you're going to see in the United States are people who are planning to apply for a green card through a family sponsorship. Next slide. But as I mentioned briefly before, when you do face a public charge test, only two kinds of benefits are really considered in the test. And those are the monthly cash aid benefits like SSI, CalWORKS, CAPI, and General Assistance, or Medi-Cal that's used for long-term institutional care, like nursing home or psych hospital. And that's for long-term care, not for just short rehabilitation stints. So, and if you notice, and you'll see later on in the slides, that most of the immigrants who are going to be applying for a green card through a family member don't qualify for most of these benefits that are listed here. Next slide. So you should check if you're unsure. The way to check and not to have to worry about remembering what all the things that I just said or trying to give legal advice is to use a tool that we developed with a lot of experts in immigration and public benefits law. And that's called keepyourbenefits.org. It's available in English, Chinese, and Spanish. And right now there's a national version and a California version that you can click on. And if you see that little orange or big orange tab in the middle that says use the guide, what you do is click on that and it takes you to a screen that tells you to list what immigration status you're curious about, and you enter that status and it tells you whether or not there's a public charge test. The website also goes through in detail the things that I just mentioned here as to who's affected, who's not affected, and what benefits count or do not count. So we encourage people to use that. Next slide. So at this point is now that you kind of have the contours of the public charge test, the main emphasis these days, as you can see that most people who face a public charge test don't really get those benefits that apply, is to talk about who is eligible for the different kinds of benefits that we are usually urging people to get. Next slide. And as you can see by this little chart, citizens pretty much are eligible for any kind of public benefit as long as they meet the other kinds of requirements of that program. Lawful permanent residents or green card holders are eligible for most programs, but they might have a 5-year waiting period or have a sponsor deeming situation where part of their sponsor's income might be used to calculate whether or not they're financially eligible. And then there are those humanitarian statuses that I mentioned briefly that include asylees, refugees, people who get T visas, U visas, and victims of domestic violence who might be eligible for status under the Violence Against Women's Act, may be eligible for most of these benefits. But the undocumented, you will see as I go through the slides briefly, is that they're not eligible for many programs. Most of the programs that they're eligible for are health services and food services at school. Next slide. The important message here, though, is we know many of our immigrant families have members that have different immigration statuses. One person might have citizenship, the other might be a permanent resident, somebody else might be undocumented. And the important thing to note is that different members can qualify for different programs. And if you're not applying for a program that you probably aren't eligible for anyways, you don't have to include your immigration status or social security number or any of that. If you happen to be a parent of one of the citizen or permanent resident family members who's applying, you might have to disclose your income, but you don't have to disclose your immigration status. And benefits that are used by citizen family members or family members that have immigration status does not affect the undocumented parent's ability to adjust their status because they don't count those benefits. Next slide. So I'm going to just briefly touch on the different or highlight the various cash aid and other benefit programs so that you could see again that for many of these benefits, folks who do not have some sort of lawful immigration status are not going to be eligible for these, but many other immigrants could be eligible. And so CalWorks is cash aid for families that have at least one child whose parent is either absent, unemployed, or disabled. They have to meet certain financial eligibility and work requirement rules. But, and as you see that citizens, lawful permanent residents who are subject to some sponsor deeming and all these other immigration statuses might be eligible for CalWorks. Next slide. SSI, oh, next slide. SSI is a cash aid program for people who are 65 years and older or have a severe disability or a bunch of disabilities that prevent them from working. And again, you usually have to be a citizen, a permanent resident, or have some kind of lawful immigration status in order to qualify for SSI. But it's important to note that permanent residents usually have a waiting period unless they meet certain exceptions. Next slide. And CAPI, the Cash Assistance Program for Immigrants, is geared towards those lawful immigrants who are subject to that 5-year waiting period or might not be eligible under the SSI statute, but they are 65 years and older or have severe disabilities and would be eligible for SSI except for that immigration exclusion. Next slide. CalFresh is the major food supplement program for people in the United States, and in California we have a very generous eligibility statuses. So not only permanent residents and citizens, but many other of these humanitarian statuses are eligible for CalFresh as long as they meet the financial income. And it's really important to try to emphasize that eating well can keep your family healthy. And so if there's a family member who's planning to apply for adjustment of status and will face the public charge test, the health status of that person can really make a difference. Next slide. And then we get lastly to the health benefits, full scope Medi-Cal. It's medical insurance for California residents. And this is the most generous of the public benefit programs that I mentioned today. And they're pretty much eligible to any California resident who has, meets the financial low income status. But as you can see here, pretty much everybody who's a California resident can qualify at this point, except for folks who are undocumented who are between the ages of 26 and 59 or 49 rather. And that will change as of 2024, where there won't be any age limitations. So all California residents, regardless of their immigration status, will be eligible for full scope Medi-Cal as long as they meet the the financial requirements. Next slide. And then I'm not going to go through all of this, but you can see that there's many other kinds of services that are out there for many immigrants to take advantage of. And so we encourage people to look and find out what kinds of programs they might qualify for and take advantage of them, because they're certainly paying their share of taxes to California and the federal government, and they should try to get the benefits that they need. And I think that's the end of my presentation.
Thank you, Hope. I'm going to cover just a few slides on the intersection of immigration and healthcare. A lot of this Hope has already covered, and so we'll go through it fairly quickly. Next slide, please. I think I see a lot of celebration emojis on here with this announcement. So just to kind of recap what Hope just announced. So there's an expansion of Medi-Cal. Currently, every income eligible child or person under the age of 26 and every adult 50 years and older, DACA recipients, pregnant persons, and recently pregnant persons are eligible for Medi-Cal health coverage and benefits regardless of immigration status. Also important to note that young people who are undocumented and turning 26 this year will continue on Medi-Cal until 2024. By 2024, these individuals will be sent information about when and how to renew their Medi-Cal. And then lastly, and the most exciting news is that in 2024, so January 1st of 2024, California is removing all barriers to Medi-Cal based on immigration status. So all Californian residents will qualify with qualifying incomes will be eligible for full Medi-Cal benefits regardless of their immigration status. And so it will fill that gap between 26 and 50 that currently exists. Next slide, please. Regarding Covered California. So Covered California, those with immigration documents can qualify for Covered California and its financial assistance. Many Californians may qualify for financial assistance via premium tax credit or reductions in what enrollees pay for their health care. And this is known as cost sharing. And then in April of 2023, so this month, Biden announced the plan to hopefully extend coverage for Covered California to DACA recipients. However, this rule has not been finalized yet. It was an announcement and it's in the works. And so how this will actually be implemented and it will begin is still to be determined. And then for undocumented folks, some counties offer other healthcare options regardless of immigration status. If for some reason, let's say they do not qualify for Medi-Cal because of income and then don't currently qualify or can afford Covered California. Those are county-specific programs though, so it would be, you would have to speak to the county that you live in for more information on those programs. And then you can find out more information about how to enroll, get care, and renew in our allinforhealth.org website, where we have this flyer here that includes information to the community on all of the information that we just discussed. Next slide, please. On the same website in allinforhealth.org, there is also this roadmap that we have created. Every family is different, and while public charge test makes people nervous, you can use the roadmap to help you and your family get informed. So this is a community-friendly roadmap that families can follow to see if they trigger the public charge rule. Next slide, please. Now, we wanted to go through some case examples with you all. Unfortunately, we don't have time to go back and forth as much as we would love to regarding these case examples, but we did want to just ponder them for a second, and then maybe you can share your responses in the chat. So I'll go ahead and read this case example, and then if any brave person can respond in the chat, we would love to hear what your thoughts are. So this is the first case example. It says, Anna is undocumented. She lives in Modesto, California. With her undocumented son and her US citizen daughter, Anna is a single mother and is low income, but may be above the income level for public benefits. Anna and her 2 children are in a tragic car accident and they all need emergency medical care. Anna is panicking because she does not have health care coverage for her or her children. She was too scared to apply for benefits because she's afraid of public charge. She calls you and wants information. So my question to you all is, which services would Anna's children qualify for, and which services might Anna qualify for? I will give you a moment. Would love to hear any responses in the chat and see what you all think. Emergency Medi-Cal for Anna. Thank you, Loretta. Medi-Cal for children, emergency Medi-Cal for mom. Leticia, thank you. Yes, lots of good responses here. So most of you are right. So there are 2 siblings. Both would be covered for full Medi-Cal and their status does not matter. Now, the undocumented parents, they would be eligible for emergency Medi-Cal, but let me see, but not eligible yet for full scope Medi-Cal because they are undocumented. However, this would change next year. Now, income. If mom makes over the 138% income threshold, she would not qualify for emergency Medi-Cal. So there is that distinction. And based on the facts of this case example, we're not sure that she might qualify for emergency Medi-Cal. So if she doesn't, because of her income, then that would be a very tough situation that many people find themselves in, unfortunately. But children have a higher household income threshold. So as long as the family income is at or below 266%, both children qualify for full scope coverage. And so it's important here just to note that even if Anna does not qualify for Medi-Cal, emergency Medi-Cal because of her income, the children might still qualify for full scope Medi-Cal because they have a higher income threshold. And then lastly, and this is kind of just throwing another fact out there, if Anna was pregnant, then this might change her eligibility for Medi-Cal because for pregnant individuals, Medi-Cal income threshold is also higher. Okay, let's go to the next case example. So this is Monica. Monica is undocumented and has 2 children born in the United States. She is living in a domestic violence shelter and is having a hard time finding a job to help her move into permanent housing. Monica is struggling to support herself and her children. The shelter told her to apply for CalWorks, but she is scared because CalWorks is a benefit counted in the public charge test. Does public charge apply to Monica if she applies for CalWorks? We'll give a few minutes. I see a lot of no's. No, no, no. She needs a U visa. No, no, no. No, because she is a victim of DV. All right, lots of good responses. So if Monica qualifies for VAWA or a U visa because of the domestic violence, then there is no public charge test. If she is not applying for any immigration status like VAWA or a U visa, there is no public charge test, period, because she has no pending application. If she applies for a green card through a family petition, they will not count the children's cash. So count the children receiving CalWorks. They will not count those benefits or anyone's Medi-Cal benefits, unless for long-term nursing home care, of course. And then, let me see. And then the family's income does not matter. So before there was an issue where if the CalWorks was the primary source of income, then it was a factor that was considered, and that is no longer a factor. And so in this situation, Monica can apply for CalWorks for the children, and that will not trigger any situation. And then if Monica is not applying for anything, then there is no test at all. If she qualifies and is applying for something like VAWA or a U visa, then she might even be included in the application for CalWorks as well. Next slide, please. All right, so that was our case examples. Thank you so much for participating in those and for all of your responses. Please feel free to continue to add any questions that you might have in the Q&A code. And then here I'm going to pass it over to Liz. Thank you all.
Thanks, Lisa. So just real quickly, if we go on to the next slide, we wanted to give you an overview of resources. We won't be able to get through all of them, but if you have your phone handy, you could take out your phone, scan the QR codes to find the different resources we have available. So I'll give folks a couple of seconds. The resources that we have include about 6 or 7 different PowerPoints that kind of provide detailed notes for whoever's presenting. And the idea is that if you attend one of our trainings, you could then look at that PowerPoint, follow the instructions, and then provide the presentation yourself. And then we have a bunch of community-facing resources that have been translated in various languages. And then we also have recordings of some of our trainings, and we've recorded our 1 or 2 of our fact sheets into Indigenous languages. And so know that all that could be found by using these QR codes. If we go on to the next slide. So there's also an opportunity for you to partner with us. If you would like to request a training for a specific audience, either your colleagues or maybe your patients or someone within the community, click where it says here when you obtain the slides, and you'll be able to fill out a quick form letting us know that you're interested in doing the training, and then we're happy to partner with you to do the training. And as I mentioned, we have handouts, ABCs of Immigrant Health, and you could visit CPCA's Immigration Resource page, which is one of the QR codes, where you can find the service provider modules that I was speaking about. Next slide. This is a list of partner resources that we've collected, so feel free to look at them, dive more deeply into them when we send over the slides. And there's a big portion of our presentation that's just kind of a walkthrough of all the different resources that we have, but because of time capacity, we're going to skip those and go directly into questions. But again, do encourage folks to visit the slide deck and to more detail and look at all the different resources that we have. And if you have any questions on those resources, always reach out and we'll be happy to help walk you through those questions. So with that, I do see that Lisa put the presenter form. So if you want to ask for a presentation, fill out that form. It's in the chat. And going now into pivoting into our Q&A, our first question will be for Hope, and thank you. That's the toolkit brochure. So Hope, first question goes to you. Do U.S. citizen children qualify for cash aid?
So it depends on what program you're talking about. In order to be eligible for CalWorks, they have to be low income and be deprived of care, either because because one of the parents is either absent, disabled, or unemployed. So if you have two low income parents, but they're higher income than the low income threshold, then they're not going to be eligible for cash aid. But if you have a disabled child, you might have SSI eligibility there. So it depends on the program you're talking about. That's why it's not just, you can't just look at the income, you have to look at what program they're applying for. But generally they could qualify as long as they meet the other program requirements.
Thank you, Hope. Next question kind of goes along with your response. What would be considered severe disability? Is there a list or do you need a doctor's note?
So you usually need medical evidence that could include a doctor's note, but it has to be severe enough that it prevents, if you're an adult, it prevents you from doing any kind of work for at least a year. And that, depending on your age, could include just doing, sedentary types of jobs where you don't have to do very much. But it's a individual specific test, but the general rule is that it has to be severe enough that you can't work at all for at least a year. And if you're a child, your disability has to, again, be expected to last at least a year. And if you compare that child to a child that's a similar age that doesn't have a disability, is that how they compare how disabled that child is? And if it's got to be fairly severe, it can't just be a broken arm or a mild disability.
Thank you, Hope. Next question, are parolees eligible for CalFresh?
I don't know the answer to that question. And I will look for it and put it in the chat as soon as I was just about to look at that when we went to Q&A.
Thank you, Hope. Appreciate that.
Yep.
And in case of minor crossing the border seeking asylum, can they apply for CalFresh?
I think that you have to have an asylum claim approved in order to qualify.
Thank you. And do you know which work permit category does not allow someone who is eligible for Medicaid to receive full benefits?
I'm not sure what the question is. Are they asking what eligibility categories are eligible for full scope Medi-Cal? And
Yeah.
if that's the question, then the answer is, as long as you have some sort of work permit, you're probably going to be PRU-Call eligible for Medi-Cal, which means that you'd be eligible for full scope.
Thank you. Do you have an easy to read written educational materials for clients to help build trust so they have written references on progress and public charge? Yes, we do.
We do.
If you click on the QR codes, or if you visit CPCA's immigration research page at cpca.org/immigration, we've created a bunch of fact sheets that talk about the different access points to healthcare and healthcare insurance, and speak about it from the perspective of different eligibility statuses as well as eligibility standards, so that you could see whether or not you qualify. So answer is yes. Anything else, Hope or Lisa, that you wanted to kind of share there as resources?
I think you covered it, Liz. Thank you so much. And we will send a list of all of the resources with links following this presentation. So in case you missed any of the links shared in the chat or anything in the presentation, we will be sure to pull those out and share specifically with you in an email.
Perfect. And question, I saw this question already answered, but I'll ask it so that everyone hears it. Does Medi-Cal or Medicaid count for in the public charge test?
Oh, sorry. No, again, Medi-Cal does not count for the public charge test unless Medi-Cal is used to pay for long-term medical care in an institution. So that's like a nursing home or a psychiatric hospital, and that has to be for a long time. It wouldn't count again if it's just a couple of months. But we don't have the exact date, exact time period that counts, but we're pretty confident that just a few months for rehab purposes is not going to count. So the general answer is no for the vast majority of people.
Perfect. And if someone is pregnant, taking advantage of the Medi-Cal benefit, and then they get married and trying to get a green card, again, same answer, correct?
Right. Yeah, the main message to take away is Medi-Cal is safe to use unless you're going into a long-term care nursing home kind of facility for a very long time and having Medi-Cal paid for it. Otherwise, people should be using Medi-Cal and get Medi-Cal if they're eligible.
Awesome. And then for the information that we're sharing today, there was a question, are eligibilities only for California or US-wide? And the programs that we're focusing on are California-based. But, what we're talking about, Medi-Cal, some of those components can touch on Medicaid, especially in the portion that it doesn't count for the public charge overall test. But anything else there, Hope, that you wanted to share?
No, I think you got it. Generally, public charge is a federal rule. So whatever I said, the benefits that count, if they're federal benefits, those would count, and otherwise they don't count. But every state has different kinds of programs, like California has expanded Medi-Cal to cover many people who don't get coverage in other states. So what we're saying here today covers California.
Awesome. And this is another kind of curveball type question. For those undocumented individuals who are able to access Medi-Cal once the full expansion goes into effect, to parolees and those who are refugees, asylum, are they eligible?
Parolees are already eligible for full scope Medi-Cal under the PRUCOL categories. I don't think they're eligible for CalFresh, but I don't have the list that we rely on from for people who want to get more information about benefits and different immigrants. You can look at the National Immigration Law Center at NILC.org website, and I'm looking on their website now, and I believe that parolees probably are not eligible for CalFresh, but they definitely are eligible for Medi-Cal.
Thank you, Hope.
Yeah.
So with that, we will take up more questions at the next Q&A session, but we want to move on to our next presenter, David Kane from the Western Law and Poverty Center. So David, take it away.
Thank you. Hi, everybody. I'm David. I work at the Western Center on Law and Poverty. I'm a lawyer here to help. So we'll just jump right in, all about Medi-Cal renewals. Next slide. So what are we going to do? We're going to go through these 5 things. Tried to organize this in a way that is understandable. It's super complicated, but we'll start with 1, timing. Why and when do Medi-Cal renewals happen? 2, processing. How do those renewals happen? 3, things you can do to keep Medi-Cal coverage. 4, how to get help. Somebody needs help doing the renewal. Where should they go? And then later on, we'll have a discussion and Q&A. Next slide, please. So first, renewal timing. Why and when do renewals happen? Next, please. Well, federal and state laws require Medi-Cal renewals every 12 months for everybody. What they do, the state and the counties during renewals, is they confirm that everybody still qualifies for Medi-Cal. That's the purpose. Medi-Cal of any kind. So you can move between Medi-Cal programs during your annual renewal. It's almost like applying for Medi-Cal again, except for you do not need to report and verify things that don't change. Those tend to be things like identity, residency, social security numbers, and immigration status. Those are things you don't have to prove on renewal. Things like income are things that you have to prove on renewal. Renewals happen every 12 months, but they also happen whenever you report a change in your situation that could impact eligibility. But today we're going to be talking mostly about annual renewals. Next slide, please. That annual period is every 12 months and is broken down into 2 groups. It is people who applied for Medi-Cal. If they can remember their application month, their renewal month is normally 11 months later. If they can't remember their application month, hey, I don't blame them. I can't remember many things nowadays. It's just the month where you normally renew. If you don't know what your renewal month is, I also can't blame you. It's a hard thing to remember. You can go to the county and you can ask the county, what's my renewal month? And they can tell you. There's an example here. If you applied in August 2018, you would renew in July of every year. And then that second group that we're going to talk about less today are anytime you report a change in circumstances that impacts your eligibility. An example of that might be you report higher income, and so your renewal is processed this month. Next slide, please. There are some people who actually don't fit into any of those groups that I forgot to mention. Some people might have their renewals processed even earlier or at different times. Those are people who have CalFresh and are recertifying their CalFresh, people who lost their SSI benefits and are being evaluated for Medi-Cal, and then people who anytime during COVID may have gotten a share of cost in error, it was wrong, or their Medi-Cal was accidentally discontinued. those groups of people might see their renewals happen earlier. This slide is showing the expected volume of Medi-Cal renewals. You can see that it's not even month to month. It varies, and the highest volume months tend to be around the winter months. This is one set of numbers. There's another set of numbers from the state. Those set of numbers show that it's over 1 million people or renewals every month, 1 million people. And February is generally the month that has the highest number of renewals that are processed, likely having to do with the bump that you get from Covered California open enrollment. That's why February might be the highest. Here's the link on DHCS, the Department of Healthcare Services data on the volume. Next slide, please. So during the pandemic, you may have heard renewals were not working like they normally do. Here are the dates. If you want to know how we got to the renewal pause, it was a mixture of state and federal law. All during COVID, people could only lose their Medi-Cal if they died, they moved, or they said, please turn off my Medi-Cal, or if there was an error, which happened to too many people. Starting this month, renewals are being processed again. So all of those protections that existed during COVID ended last month. But that doesn't mean all of a sudden everybody renews at the same time, because remember, you renew during your regular annual renewal month, and it's spread out over an entire year to get to the entire group of people. Next slide, please. So what does this mean for how Medi-Cal will start to change now? Well, those COVID protections ended on March 31st. Counties are starting the very beginning of their renewal processing this month. We'll talk about that shortly. And at the end of that renewal processing, the first date of Medi-Cal cutoffs is July of this year. Next slide, please. Jumping into renewal processing, how do renewals happen? Well, on the next slide, we'll go through the standard renewal process. First, the county tries to renew people automatically, also known as ex parte or ex parte. Two, the renewal packet or form is mailed out. Then a lot of stuff happens once the renewal form is mailed out. We'll go over that shortly. And then three, at the very end of it, in the standard annual renewal process, the county continues Medi-Cal eligibility if the person still qualifies, or they end it. If you're eligible for Covered California, you'll be automatically transitioned to Covered California. If you're not eligible for any other type of Medi-Cal, your Medi-Cal will unfortunately just end. So on the next slide, let's jump right into automatic renewals. You may have heard of this, also known as ex parte, ex parte. This is where the county tries to renew people automatically. It really is that simple. It happens automatically behind the scenes in the computer. When? The first month that is 2 months before renewals are due. So if you really want to know when this happens for people, that's when it happens. For example, it happened earlier this month for renewals due in June of this year. Medi-Cal will be renewed if this is good for you without you, the person with Medi-Cal, needing to do anything. You will simply get a letter in the mail that says your Medi-Cal has been renewed for another year. Done. You don't have to think about it for another year. It's great. This can happen to almost everybody except for large categories of people. These are them. People who do not have social security numbers on file at the county, which is a lot of people. And people who are age 65 and older or disabled, and they have Medi-Cal based on their age or their disability. Those groups of people almost never go through the automatic renewal process. So that's good to keep in mind if you're trying to help people. So for everybody else who doesn't go through the automatic renewal process, which is roughly 70% of all people with Medi-Cal, they have to respond to the renewal packet. Next slide, which is what is sent to everybody who doesn't automatically renew. It asks people for all the income to reprove their information, including income, to reprove their Medi-Cal eligibility. When does the packet go out? The third week of the month that is 2 months before the renewal is due. So that is for renewals due in June. It went out this week, actually, to everybody statewide. The due date for that packet is actually almost exactly 2 months later, is what it'll say in the packet. The real due date is the end of that month. So for the packets that went out this week, the real due date is the end of June. If you turn in all information that the county needs or submit it, your Medi-Cal is renewed. But if the county needs more information or something happens with what you submit not processed properly, you must take action to keep your Medi-Cal. So next slide, that goes into what would happen then. The county will send a bunch of requests to you. They are reminder notices. They are specific requests for information. They send 2 reminder notices the month before the renewal month. So for these renewals due in June, those reminder notices go out in May. And then if the county needs anything from you after looking at what you already turned in, like sometimes you might mention something on your renewal packet and the county says, oh, we need some more information or proof about that thing. They will write you a letter that checks a box saying we need more information about that thing. They'll also send that to you. So you need to respond to that by the due date that's in there. And if you do, and it's enough, good, the Medi-Cal can be renewed. If it isn't, you have to respond again to whatever the county sends you to try to keep your Medi-Cal. So next slide is what would happen next for people who still haven't renewed. The county will send what's called a termination notice. This is for people who were not processed with continuing eligibility already. It arrives 10 days before Medi-Cal ends. So it'll arrive toward the end of June for the renewals due that month. And it sets a due date for people to turn things in. They still have to the end of the month once they receive this to turn in their information. And if they turn in the information before their Medi-Cal ends, the county has to keep it active until they process it. And if you don't respond to this, unfortunately, the Medi-Cal ends. So next slide is the final step. We're here. The county makes an eligibility determination. They decide whether Medi-Cal continues or discontinues. It is effective at the end of the renewal month. They can continue Medi-Cal though at any time. So if you turn in your renewal packet you got it this week and you turn it in 2 weeks, the county might process it real fast and let you know in May that your Medi-Cal has been renewed all the way until your next renewal month in June of 2024. But for any negative action on your Medi-Cal stays active all the way until the end of your renewal period, so the end of June for renewals due then. Then on next slide, if you were not auto-renewed or renewed successfully through that process, which was a lot to go through, you still have 90 days after your Medi-Cal ends to turn in any information the county needs to process your Medi-Cal. So that's a good thing to keep in mind. The county has to receive everything that they need, and then they have to turn the Medi-Cal back on. And if they do that, they close the gap in any coverage. So next slide is a graphical illustration of this, if it helps. For the renewals due in June, we do that automatic renewal around April 7th. Good news for the 30% of people approximately, or 40%, 30 to 40% that go through that. They have nothing else that happens. Their Medi-Cal continues. It's awesome. But for everybody else, renewal packet mailed. You can see the 2 reminders that are mailed to everybody in the in-between month, which is May for this group. That's when people can respond to all the information requests from the county. Then you have your termination notice that happens on June 20th. That's your best indication that something did not go right with the renewal processing. If you get this notice, that's a reason to respond immediately, contact the county, figure out what they need to keep the Medi-Cal on. And then July 1 is the first time that Medi-Cal would cut off in this situation. So next slide is an example with Anna. If Anna receives her renewal packet in late April, maybe this week, what happens if she fills it out and returns the packet in early May? Or it's incomplete, or she doesn't respond? Any ideas? Put them in the chat, please. I'll start by just saying she fills it out, returns it in early May. Great. Get it in early if you can. The counties need the extra time. There's a lot of renewals they have to process. So Anna did the right thing. Hopefully, if the renewal packet was complete, her renewal will be processed And so if it isn't, she can look for the mailings from the county in late May and early June, respond to them, turn in the information the county needs. That would also happen if her renewal packet is incomplete. But if she doesn't respond, then Medi-Cal will send her all of those reminders and the termination notice at the end of June, and then Medi-Cal will end at the end of June, but then she has 90 days afterwards to turn in what the county needs to turn the Medi-Cal back on. Next slide is we'll go real quick through, this is what the renewal forms look like. They changed in late 2020. They're improved. They're pre-populated with information. They're easier for people to complete. Also on the next slide is the yellow envelope. Renewals are coming in yellow envelopes this year. You can let people know they should fill out their renewal form when it arrives in a yellow envelope. It includes on the next slide this insert that encourages people to renew it or lose it. This arrives at the end of the renewal packet. On the next slide is the reminder notice. This is one of the 2 notices that goes out. They're the same, but that's what it looks like. Next slide is some information about those renewal forms. They're currently available and translated into all 19 threshold languages. The counties are sending them in 13 of those languages right now. Starting later this year, they will be programming in these 6 languages: Hindi, Min, Japanese, Punjabi, Thai, and Ukrainian. They will have them completed and programmed by September, which is good news. In the meantime, you can ask for a packet in any of the 19 languages and the county can give it to you. Next slide are some special rules for immigrants. This was previewed earlier. So it's the people who turned age 26 during the pandemic normally would revert to restricted scope this year. But good news, the counties and the state are pushing out their renewals. So here it explains that for people who have anybody in their household who is age 65 or disabled, 65 or older or disabled, their renewal date has been moved to January. For everybody else, it's between February and May 2024. So that's when they should look out to renew. If they are largely people who are undocumented and turned 26 during the pandemic, this is the rule that applies to them. It's good. We'll look at it here on the next slide with Renato. He lives alone and he turned 26 in August of last year. Normally he renews every June and he knows it. Good for him. Or maybe he called his county and they told him. Renato will renew not this June because of that special rule, but anytime between February and May 2024. But if Renato lives with his disabled sister who also has Medi-Cal, then Renato has somebody who is either age 65 or older or disabled. So that means his renewal will be due and processed in January. Real quick, next few slides, and we'll go to the next one, are on assets and property. Medi-Cal does not count assets and property for renewals this year or ever again. It's that simple. So people who were worried about being over asset or over property to renew this year, don't worry about it. Counties are not asking for asset information. This applies to annual renewals right now through the rest of the year, starting January 1, 2024. No asset limits, even for Medi-Cal applications, no asset limits anymore. It's great. Next slide is about sworn statements. Sometimes it's hard to get the thing to the county that the county needs. They might ask you for something that doesn't exist or is really hard to get. So if that happens, you can submit what's called a sworn statement. An affidavit is another word for it. You can verify anything that the county asks for, except for social security numbers or immigration status or citizenship. You can submit this by phone, mail, in person, and online. By phone, it's allowed. So if that's the way you get in touch with your county, you can try this. Technically, there's a last resort requirement, which means the county might ask you to have tried something else first. So you might try something else first to qualify for this. There's details in that letter that'll be in the slides. On the next slide is another way that you can prove something. Just about your income. This one applies to income. If the county might reach out to you if that happens, and they might ask you, what's going on with your income? Because we looked it up and we saw that your income is higher in the electronic data we can see and not as low as you told us it was. If that happens, you can just tell them why it's lower. As long as it's a reasonable explanation of why your income is lower, such as my hours went down, they must accept that and not ask for any other income proof. So it's a good tool. That also can be submitted by phone, online, paper, in person, and you can use an optional form that's linked in the slide. So moving on to the next slide, things we can do to help people keep their Medi-Cal during this process. In addition to all those rules that we just reviewed, you're an expert now. You know all the tricks of the trade. These are some things we can do. Next slide. Things that people can do to take action today to keep their Medi-Cal. Get ready to renew by updating your contact information. If you moved at any time in the past 3 years, address, phone number, email address, anything changed, tell your county. Your county wants to know so they can contact you during the annual renewal process. Watch your mailbox for yellow envelopes. Respond to all requests from the county. They might not just mail you, they might call you also to ask for information. Also, if you can use the internet, sign up on benefitscal.com. Get yourself an account. You'll get an alert when your Medi-Cal renewal is due. You can also sign up for general alerts on these state websites that are on this slide. Next slide, we will skip because of time, sorry, and move on to outreach and education. We as people who are working with people and helping them keep their Medi-Cal can also sign up for these alerts, and we should. If you haven't already, sign up for the alert list at keepmedicalcoverage.org. Also, you should sign up to be a coverage ambassador. It's not a big commitment. You just receive the latest information. You'll get information and useful resources from the state. So sign up for that so you know the very latest. For example, they sent an alert about some Medi-Cal renewal fraud that's going on. People are trying to charge people to do their Medi-Cal renewals. We got an alert through the email list from the coverage ambassadors to watch out for that and educate people. Never pay anybody to do your Medi-Cal renewal. You will never be asked to pay to do your Medi-Cal renewal. DHCS has also developed an outreach toolkit that has call scripts, emails, flyers, social media, and videos. You can check it out at that link. And when we are doing our work on the next slide as assisters and advocates, we should be reminding people to watch out for the yellow envelopes, sign up at benefitscal.com. Remember, you can submit whatever the county asks for by phone, online, or in person, or mail, however you want to do it. There's a special process called a state fair hearing that you can also request to try to keep the Medi-Cal active or get it turned back on. You can help people during the 90-day cure period to get the Medi-Cal turned back on as well. And you can visit our website here, healthconsumer.org. We have all of these rules that I covered and more, and suggestions on our special website. On the next slide, we go through where people can get help renewing. On the next slide, you all and people you know who are health navigators. This is just a sampling of them. There's a list that you can access and learn about more. Next slide, you can also contact the Health Consumer Alliance. That's where I work. I'm part of it. Free legal assistance and answers to questions. You as somebody without Medi-Cal, maybe just helping somebody with Medi-Cal, you can call too if you have a question, and we'll talk to you to make sure that you get what you need. Next slide are some resources. If you want to find more details, there are links there. And the final slide is you can contact me anytime, really, call me. That phone number is real and it works. Or email me, happy to work together. Thanks.
Thanks so much, David. Great information. So next we have AltaMed to kind of share the perspective from the health center world as they approach Medi-Cal renewals and kind of their unique thoughts on how to do this. So AltaMed, feel free to take it away.
Thanks, Liv. Hey, everybody. I'm Stan Glickman, AVP at AltaMed, and we've been doing a lot of work around this. David, thanks for your slides. A lot of really, really good information. I think what I'll share is what are we doing with all that information to try to create a safe place for people to come to get help to renew. Great point that there's an alert out that there are people looking to charge individuals who need to renew, and we're trying to make sure that people know this is the place to come for answers. So let's go to the next slide. So this is just the top line. David's covered most of this. It sort of gives you the what and the when, and he's gone through that pretty well. There's about 15 million Medi-Cal enrollees who will be required to renew over the next 14 months. That second bullet is important because there's a sub part of this population are people who were presumptively eligible during the public health emergency that now need to apply for Medi-Cal. So that's an important group that we're looking out for because they've never been through this before. All right, next slide. So this is a different perspective, but same idea as what David shared. The way we're looking at this is sort of in a 90-day tranche, right? That's going to run every 90 days, where we start our omni-channel campaign at 90 days out to let people know to look for that yellow envelope, provide them with a landing page where resources are available and the like. Then the county starts their ex parte process. We're working closely with the health plans to try to get lists that tell us who have been automatically renewed. Because one of the big challenges here is there's so many people coming through the funnel. How do we get them all the way to the point where we're taking care of folks? And you'll see that that's part of what we're thinking about in our plan. So then the state sends out their piece 75 days in advance. We start very targeted omni-channel outreach to our patient population with lists that we have. And then we do reminders in parallel with the state and the county. Okay, next slide. So this kind of looks at our overall approach to levels of engagement. Hopefully this is helpful for you guys as you think about it. So on the left, you have kind of one-to-many strategies. And then as you move to the right of the funnel, you have one-to-one tactics. So overall awareness is the key, redetermination everywhere. Obviously, not using redetermination as a language, but keep your coverage, look for the yellow envelope, don't lose your doctor. All of those things are critical. So we're looking at that for every place that we have patient-facing staff, all of our clinical locations, all of our PACE locations and the like, and then using a variety of communication channels, including direct mail, websites, blogs, social media. When people call in, what do they hear in the recordings and the like. As we move further, we've got strategies in place that are one-to-many, meaning how do we then take a small group of people and really take the information that David shared and bring it down in a place where people can ask questions. So there we're driving people virtually to a landing page that has all of this information and links on it, including videos. I'm going to show you an example of that in a minute. But then what's really important is our town halls, our virtual conversations online, pop-up events that we're going to do in partnership with health plans and CBOs throughout both LA and Orange County, where people can gather, meet them where they are and talk to them about this really important issue, as well as any events that we're already doing in the community today. Really important to work with the ambassadors, as David said. Any CBOs that are already signed up to be doing this work are great partners. So that's kind of the one-to-many approach to try to give people as much information and the opportunity to answer questions. As you get to one-to-one, now you've come through the funnel. We've got as many people trying to renew their application online, go to resource centers, do it on their own. But those that need one-to-one help, then what do we do? So the approach here is everywhere we check eligibility, everywhere we talk to patients, that's our opportunity to find out if it's their renewal month or are they aware of it. Once we know that, then at the time that we're checking for eligibility or we're meeting with them, we have a couple of different strategies in place. One is we can make an immediate appointment for them with our patient care coordinators. Doug Morales is on the call today. He runs that group. So we have an entire group of enrollers that can help out. We can also redirect them to dedicated call center representatives that can help with the application or answer questions. And then we can make in-person appointments our own or at the resource centers that partner plans and partner CBOs are putting up. So that's kind of the overall look. That the whole thought there is, man, there's so many people coming in. How do we drive people to do it themselves? And then how do we help them? Next slide. So this is an example of the landing page. When you go onto that landing page, you'll see that a lot of it's been updated, but essentially what you see is we're trying to bring everybody to one place so that we can continually update that information, make sure that people know this is where you can get safe and trusted answers. Most importantly on that website are videos that we're creating. I'm going to show you an example of that. But what's really important about the video strategy, A, it's in English and in Spanish, and B, it's designed in such a way that we can take small segments of video and push them out through SMS, or when you search on Google, you'll find the chapter in the video. So if you want to know, how do I upload a document onto Benefits Cal, there'll be a segment of the video that can answer that question for you. Let's go to the next slide. I'll show you just a minute or two of that video. If you could play, that'd be great.
Hello family, I am Dr. Ilan Shapiro from AltaMed. Today I'm here to share some important information with you about medical benefits.
This video is for people who have Medi-Cal. We want you to keep your doctor and keep your coverage. In this video, we're going to show you how to do that. First, let us explain what's happening. The state of California requires that everyone on Medi-Cal renew their coverage on an annual basis. During the pandemic, it was not necessary to renew your coverage. Now that the public health emergency is over, the state is asking Medi-Cal recipients to renew their coverage. This is called the renewal date. The renewal date is based on when you first received coverage. So, for example, if you obtained Medi-Cal coverage in June of 2022, then you will most likely have to renew it by the end of June of 2023. There are two things that you need to be aware of. First, your contact information must be up to date so that you receive your renewal packet in the mail. In a few moments, we will show you how to update your contact information. Second, you must look out for the yellow envelope. This will contain your renewal packet. For now, an important step you must take is to update your contact information. There are 4 methods to do this: by mail, online, by telephone, and in person. We strongly recommend that you update your contact information and renew your application online. It's the fastest and easiest way. This is the Benefits Cal website located at benefitscal.com. We will show you how to use this website to create a benefit.
So you can see we're doing our best to take all that complicated information that David shared with us and put it into a format that folks can understand. They can stop and check it. We can also share that in our direct response campaigns. There's a key piece there that we should call out, and that is that since January, there's been a lot of information put out that folks need to update their contact information. That's critical. You're never going to get the yellow envelope if you've got wrong contact information. We all know that's a huge challenge in healthcare and in the state and county databases. So we're doing a lot to drive people to first do that, and trying to separate those messages so that we can just help people realize, look, not everybody's going to get renewed right away, but all of you need to update your contact information. So that's part of the strategy. Next slide. We can go past that one. So some of the other segments of the videos, just to kind of call it out that are coming, will be how do you create an account on Benefits Cal? How do you link that account to your Medi-Cal account? Because that's the only way that you can renew or update your contact information. You have to link those 2 accounts together. So that's really important. And then once you're there and you get that yellow envelope, how do you upload documents? How do you do the things that David described? And so all of those will be coming onto the landing page. We'll put the link to the landing page in the chat. And so that's kind of what we're thinking about. So feel free to use that resource, guys. What you're looking at here is, again, just our direct marketing, right? It's the one-to-many outbound strategy and the one-to-one inbound strategy. So we think about that from a multi-touch model. We start with text, we layer in phone, we layer in email. The basic idea is we do all that we can to drive people to connect with us. First, to tell them to update their contact information, then as they need help, to put them into a place where we can help them as fast as we possibly can. So that's kind of what the intent of this slide is. For anyone who's trying to think about working with your specific constituents or population, I think a multi-touch model is a really, really important approach to this. Next slide. So what you're looking at here is, you know, man, how do we handle the appointment capacity? How do we get there? So the way we thought about that is we looked at the month-over-month renewal periods. We have a lot of data on our patient population in Southern California. And so we cross-referenced it with our eligibility files from the health plans so that we can create very directed lists month over month for who we're talking to. The image you see on the left comes from the state toolkit. It basically shows that renewal process that David talked about. In the middle, what you see there is we took our data so that we can understand month over month, what's that volume that we're expected to try to help. The appointments needed per day assumes 100% of that appointments. Obviously, our entire strategy is driven to drive people to a virtual solution as much as possible. And then we can take on the physical appointments. And then we've created a map for all of our internal associates and for anyone that we're sharing information with. Here are the physical locations where we can help you, which is basically our clinics, the health plans that have stood up resource centers, as well as CBOs that will be offering assistance as well. For those of you who are going to get into the nitty gritty of this, then the next step, if you have call agents that are going to help, is what's, you know, how long is it going to take to renew the application? And we've been working with some partners on that to determine what that volume looks like. All right, we can move forward real quick. So these are some slides that the Community Clinic Association put together. They're really helpful to give us a sense of what that volume looks like. David shared a little bit around this. So you're looking at the supervisorial districts in Los Angeles County to give you a sense of what the volume might look like, both in cases and individuals. We can go to the next slide. Here, what you're looking at is the number of cases that are going to go to auto renewal and those that will go to manual renewal. It looks like it's a pretty hefty amount that they're going to try to auto renew. A big issue for us is that we want to try to find out who those people are that got auto renewed so we can take them off of our direct strategy. But the important slide is the next one, which is that not everybody who goes through auto renewal will become successfully renewed. So what you're looking at here that the team put together is just an example where you have a total number of cases, say in June, of about 184,000. Those that go to auto renewal, some close to 70% of that. But the expected auto renewal success rate is about half of that. The remainder would need to be manually renewed. So that's really important for us in terms of who do we have to give extra attention to from an outreach perspective. And I think that takes me to the end of the slides. Hope that was helpful. Happy to answer questions.
Thank you. Thank you, David and Stan. Very helpful presentations. And we did get a bunch of questions. So just noting for folks that we've been answering those questions within the Q&A box. And we've also posted some of these questions within the chat. Just in case you're seeing one or the other, we wanted to make sure the information was getting to all audiences. So with that, we'll address the open questions. And if we have time, maybe I'll ask David to maybe call out a couple of questions he may have already responded to that he feels would be important for others to hear the response on as well. So first question, if a client is undocumented and has emergency Medi-Cal and they go to the ER, should the emergency medical cover the medical cost? And I don't know if David, you want to take that, or if maybe that's more of a hope question. So I'll let you guys decide.
Thanks, I can start. I was trying to research the exact language, so I'll look for that. Generally, it is treating the emergency condition. So, and that emergency condition ends only when a medical professional says you have stabilized. So that's legally what must be required, but we know in practice at providers, they know the ins and outs of exactly what is and what isn't.
Right, and just because you go to the emergency room doesn't make it an emergency that emergent restricted Medi-Cal will cover. So that's the caveat there. And unless we know exactly what the person is being treated for, we wouldn't be able to say that it's guaranteed to be covered. So a lot of people use the ER as an urgent care rather than emergency care. And so they might get stuck with the bill that the hospitals might be able to cover in other charitable kinds of categories. So
thanks, Hope and Dave. Appreciate your responses. Next question, and maybe this is more for AltaMed, but anyone who feels comfortable, please answer. Is there a range on the amount of time that is needed to assist a patient to help with renewal applications? So to fill out renewal applications, does it take 15 minutes, 30 minutes? How long should someone kind of estimate per patient or per application?
Yeah, that's a great question. I'll take a shot at it. So based on experience over the years that we've done this, if you're doing a physical renewal with somebody, it can take up to an hour. In talking with our contact center partners who are doing this today online, they've got some tricks to make it more efficient, and it can take 10 to 15 minutes per individual in a household to help them walk through it and actually fill out the forms online. So it's going to be somewhere between 15 and 60 minutes, depending on how much help is required.
Thank you. That's super helpful. Next question. If someone's a newcomer, undocumented families, can they apply for emergency Medi-Cal?
Yeah, and especially consider applying for full scope Medi-Cal. Really, we're in a place now where most people should get Medi-Cal. Immigration status does not matter. You get the full scope Medi-Cal. The only people right now who do not get Medi-Cal, and don't mean to minimize this group, it's over 800,000 people, are people ages 26 to 49. Those people right now would only qualify for emergency or restricted scope Medi-Cal. So it depends on your age this year. Still, even if you want to sign up for restricted scope and you're only eligible for restricted scope because you are between the ages of 26 to 49, sign up now, because starting on January 1, it will automatically turn into full scope regular Medi-Cal.
I want to jump in on that, guys, and I want to make sure I'm saying this accurately. So our understanding is for those who are presumptively eligible during the public health emergency, they need to apply for the first time for Medi-Cal. Am I correct, David and Hope, in saying that? Because that changes the nature of the conversation to a full application as opposed to renewal. Do I have that right, guys?
Yes, good point. Somebody who's in a presumptive eligibility program, like especially the COVID-19 uninsured group program, that has an end date that's ending at the end of May. If you are one of the 500,000 people who have that coverage in our state, you need to submit an application for full scope coverage to continue coverage.
And that, for all of us who work with patients, that's really important, right? Because they may not realize that they don't have coverage. If they had meds, let's say, that were a 90-day script, and they go to renew the script, and all of a sudden they don't have the coverage anymore. So we're doing a lot of work around that, and I think it's a really important point.
One little point that I just wanted to add is the person mentioned newcomer. They have to establish California residency in order to be eligible. So California residency is different from having an immigration status. Which you should be able to show fairly easily. There's no time limit or waiting period to establish California residency, but you do have to have residency. You can't just be, a tourist who's planning to come in for a little time, a little while, and then go back home.
Right. And then another question that came up, and I think this is the one that we're still talking through as advocates, which is, do they plan on updating the FPL, the federal poverty level, to meet the cost of living in California? Anything that folks would like to share there? I know that advocates are looking at this and trying to see if there's something that can be done. But it is, FPL, I think, is determined at the federal level. So to receive federal funds to help cover the cost of providing that care, we would need to do something in accordance with them. But if the state wanted to raise it, they could also do that, but the state would have to cover the full cost of providing that care. anything there that folks feel I got wrong or anything else that folks want to add? Awesome. And I guess the last thing I'll bring up here is for those who are DACA or undocumented, can they access covered California? And I think there's a nuanced response to that given the Biden rule, but I'll allow to see if anybody here on the call wants to respond. Otherwise, I'm happy to take it. Okay, so right now, if you are DACA today, for covered California, you will not be able to access or buy insurance, unfortunately. But there is a new proposed rule that the Biden administration has put out, and Lisa kind of touched on it in her presentation. And in that rule, it does or proposes to allow DACA to access the state marketplace to then access covered California state plans or other plans within other states in their ACA version of the marketplace. So more information to come on that soon, but there's hope that there will be expanded coverage and that DACA recipients will soon be able to access the ACA, which will help with the FPL question that we received, because you would be able to apply for covered California and hopefully be able to access some subsidies. So with that, that is the end of the question list that we had. Again, there's a bunch of questions that our awesome presenters did answer on the back end. So feel free to review those responses if you so wish to. And I do want to kind of lead us now into our closing. So again, thank you everyone for participating. It's been a great webinar. You guys had great questions, and thank you for being so involved. And big, huge thank yous to all our speakers for not only helping to put the presentations together, but of course, doing a bunch of backdoor coordinations to get everything ready. Thank you, TCP and everybody else. And then also thank you for all the great responses to the questions and being able to do that on the back end. We do have an evaluation, and so that will be placed in the chat, the link to our eval. So please do take that evaluation, because that is how we can make improvements to our trainings in the future. We want to hear from you. So help us be better by responding to a few questions. And then also a reminder that the slides will be sent in a follow-up email, and we will also include, I believe we were recording the training. So if we will be sharing the recording as well, along with all the different resources. Again, our contact information are within the slides. So if you have any questions, please do feel free to reach out, and we are more than happy to assist. So with that, anything else that our presenters would like to say in our closeout? All right.
Thank you, everyone. Gracias.
Thank you.
Thank you. Bye-bye.
Bye, thanks.